But what you hear is an argument about cost. But the notification of a physician is a very important aspect of this bill. Physicians must know what medications their patients are taking. And this substitution to a similar product is unique when we're talking about biosimilars. But when a doctor writes a prescription, he takes responsibility for side effects and any interactions that that medication may have with other medicines that patient is on. If this amendment is successful, doctors won't know if the patient is on the medication that they prescribed or a similar agent. This is much higher level than treating a sore throat or blood pressure or cholesterol medications, which the chemicals are identical, they're the same. And biologic medications are used for patients who often have life-threatening conditions such as systemic lupus, rheumatological conditions, multiple sclerosis, HIV, and other autoimmune diseases. And even though by batch, the biologic medications can vary in themselves, they're often from the same line. And they have predictable adverse effects and interactions with other medications that that patient will be on. But if you go to a completely different line, a biosimilar, even if the FDA says that you can substitute it, the interactions and the side effects may be different. And when that physician gets called at 2 in the morning, the patient may not even know which drug that they're on. And changing to a different line means, of course, there's different side effects. If this amendment passes, patients who are already in a treatment program, they're on a series of medications, they may see that their medicine has changed in the middle of their therapy. And this could hamper their healing. And our citizens and your family members deserve better. This amendment goes against patient safety. Pharmacy companies, they communicate with my office every day, dozens of times throughout the days about medication availabilities, and they notify us when patients need refills. There's no hassle to the pharmacy. This happens all the time electronically. And usually, only a doctor will know what drugs have been used previously on that patient. And they'll know what had been successful and what wasn't successful. And they could spend the patient's money on a medication that was already tried previously that was not successful. Pharmacy profits should not be the only determining factor. And the physician should be involved if the patient can't afford the medications. Both these medications, the biologic medication and the substitute medications, are both going to be very expensive. And again, these are for some very significant diseases. And there's no predicted savings between these two medicines. 59 healthcare organizations sent each member a notification that they're not in support of this amendment. 59 different organizations. That includes the FMA, FOMA, the American Autoimmune-Related Disease Association, the Alliance for Patient Access, Kidney Cancer Association, BioFlorida, Florida Psychiatric Society, Lupus Foundation of Florida, Colon Cancer Alliance, Florida Osteopathic Medical Association, the AIDS Institute, the National Alliance on Mental Illness, the Community Health Charities, Florida Society of Rheumatology, Health HIV, and again, up to 59 different organizations are against this amendment, and they are for physicians being notified. Yeah, I heard that the FDA will eventually develop guidelines on which drugs are going to be substitute. It may take the FDA years, or it could be months. The FDA is very hard to predict. But I can almost tell you they're not going to sit there and tell you how a pharmacy should notify a physician if they've substituted that medication. And if you have the dispenses written, somebody said you just check a box. Well, that's not in Florida law. In Florida law, you can't just check a box. You have to write. A physician has to write in his own handwriting, dispense as written. They have to write it out. And if you're doing electronic prescriptions, it's almost impossible to do. You know, liability, again, relies on the physician. It doesn't rely on the pharmacist. It doesn't rely on the company that provides the medications to the patient. It's on the physician. That physician has a right to know. And I appreciate it if you vote down this amendment. Thank you.